My name's Dan Wootton. I'm a consultant respiratory physician and I also work at the University of Liverpool as a senior clinical lecturer. My research project at the moment that I'm focused on is looking at a condition called hospital-acquired pneumonia. It's a really common condition. It's recognised now as being the most common healthcare associated infection in the UK. So the idea is if we can diagnose hospital-acquired pneumonia more rapidly and more accurately, that will have real, meaningful clinical benefits for patients and for the NHS. I chose to engage with policymakers and to look for funding to support that work because we need to get people aware of the condition and make sure that the right research is being done to fill the clinical knowledge gaps, but also from an academic perspective to ensure the research is having the right impact. I need to understand who are the policymakers, what are the gaps, and put it in front of the right people at the right time, in the right way. There was a diarising issue, I think, because we were trying to engage with lots of different policymakers in a relatively short time frame through a modestly funded project. It was difficult to get people to commit to particular times that met everyone's agenda. And also a subtle sort of diplomatic challenge because there are slightly conflicting priorities of different policy-making organisations, and we wanted to make sure they all had equal share of time and voice and that we were aware of what everyone's agendas were. So there are a number of challenges, but it was a really rewarding process. I found it a really valuable process and worth the effort. I think the real fruits of this policy work that we're doing aren't going to be seen for a while. I'm hoping that what we'll eventually achieve is an understanding and a relationship with these organisations such that our research results can have a greater impact than they might have done if we hadn't carried out this. So I think I'm confident that the process is going to be beneficial in a research context. I found it very personally beneficial in terms of making contacts within the broader field within which I work. There have been unanticipated benefits in terms of my research and clinical network that weren't an initial priority of this project, but have sort of been side benefits, and I think that's a real advantage of this part of this sort of work. It makes your research feel like it could have a larger scale impact. There is real value in having comprehensive networks, including people at the receiving end of this policy, so the people who have to enact the policy in perhaps a clinical or professional context, the policy makers, people who are delivering the research that underpins that policy, and ultimately the public, or in my case patients, who are on the receiving end of that policy. I think it is vital that all those different stakeholders are looped in. I think that's where the greatest rewards are to be had, but I hope that other researchers and contributors in this field also see the value of that cohesive approach to doing this sort of work.